Hi, my name is Allie Blundell, and today I'll be talking about preterm labor. Preterm labor is considered to be one of the most common obstetric complications that would occur during human delivery. It can be described as contractions of the uterus starting before 37 weeks of pregnancy. Preterm labor can occur anytime between 20 and 37 weeks of pregnancy. The result of preterm labor is changes in the cervix, which results in dilation and effacement. Dilation is the opening of the cervix, and effacement is the thinning and shortening of the cervix. Both of these have to occur for the baby to be delivered. There are a few causes of preterm labor. Inflammation and/or infection of the fetal placental unit can result in early delivery of the baby. This increases the risk for neurodevelopment disorders in the newborn. Another cause of preterm labor is high fetal fibronectin levels. Fetal fibronectin is a protein that is believed to help the amniotic sac stick to the lining of the uterus. Most healthcare providers will do a fetal fibronectin test to determine the chance of preterm labor. If the test is negative, then it is likely that the mother will make it to full term. However, if the test is positive, indicating high levels of fibronectin, meaning that it is not as sticky and the amniotic sac is more likely to detach from the uterus, then the healthcare provider will most likely take steps to prepare for preterm labor. Lastly, 25 millimeters is used as the cutoff to determine if the cervix is in normal length. Mothers whose cervix is less than 25 millimeters before 28 weeks of pregnancy are at high risk to deliver their baby preterm. Symptoms of preterm labor occur during the second trimester. They can be identified as smoking experience, pregnancy complications such as change in vaginal discharge, such as it is more watery, mucousy, or bloody, or just a larger amount of vaginal discharge than normal. Pressure in your pelvis like the baby is pushing downward. Constant low, dull back pain. Regular or frequent contractions that make your belly tighten. Also, pregnancy-specific stress can also be a symptom of preterm labor. There are many concerns for the baby and the life they will live if they deliver preterm. In many cases, the baby turns out to be happy and healthy and does not exhibit any consequences of preterm labor. However, there are some serious concerns that people worry about when delivering preterm. One is serious health problems such as cerebral palsy, asthma, because their lungs are not fully mature when they deliver, and bronchopulmonary dysplasia, which is a chronic lung disease affecting newborns that causes damage to the lungs due to mechanical ventilation and long-term use of oxygen. Most infants fully recover from BPD, however, some have lasting breathing issues. Another concern is learning disabilities. Dyslexia is a common disability, as well as just lagging behind in school a little bit. However, many children catch up during elementary school. There are some medications that a healthcare provider will give when a mother is delivering preterm. The first one could be any corticosteroids, such as dextromethasone and betamethasone. These corticosteroids can cross the placenta and speed up the development of the baby's lungs, brain, and digestive organs to help them thrive after they deliver. This is usually given mothers who are between 24 and 34 weeks. Another medication that is given is magnesium sulfate. This is used to prevent seizures during labor. It also may help reduce the risk of cerebral palsy. It is given to mothers less than 32 weeks in preterm labor who are also at risk for having a baby within the next 24 hours. Tocolytics are also used to delay delivery for up to 48 hours. These allow time for magnesium sulfate and corticosteroids to be given. It can be used with magnesium sulfate to protect against cerebral palsy.